Hi everybody, I'm Dr. Qazi, a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation as well. I'm going to walk you through this case. This is a patient who had deep Icepick scars. She also had a lot of volume loss. You can see with her, she was actually a patient in her 40s. The scars themselves had destroyed some fat. And then as she got older, she noticed that her scars were a lot worse because really the fat loss really ended up making it so that it looked a lot more depressed over here. So we had to do a few different steps really to achieve this particular result. We're still continuing to get better improvement over time. This was really something that over the course of the next few few sessions, we could even continue to get better and better results. But you can see, look at how deep those deep Icepick scars are, those that volume loss that's over here. It's really deep over here, that amount of fat loss. Part of it's just as she got older, she's in her 40s. Part of it's because of the scarring. Hi, Joey, good seeing you on. And hopefully everybody can hear me now. It was a little bit off earlier, so hopefully you guys can hear okay. And we'll walk through this particular case. This is a good one because I do a lot with Icepick scars. I do a lot with patients as they have volume loss due to their scarring. And a lot of times it just looks a lot worse because of that volume loss. So we'll go through and see really how we could do this and hopefully help people out that feel like they don't really have as much hope. Today was really like an interesting day. Appreciate you too, Stephanie. Hi, Mrs. Jones. Good seeing you too. Today was an interesting day. I had a lot of people that just were feeling like, that they had come to a point where they just didn't get much hope before they came to me. I had a lot of follow-ups, actually. It was really interesting, actually. One of my patients, he actually always comes on here also over here. And he was talking about how he just, he suffered a lot from not just the scars, suffered a lot because he had severe acne when he was growing up. By the time he was in eighth grade, had really bad acne, was bullied for it. And he used to play baseball. And then he ended up, just because really a lot of it was because of his acne, he just ended up just not doing too much. And you hear that story over and over. And it's, now this is, I'm working on the second step for this patient. And he's just, clearly doing a lot better. His skin's doing a lot better. And it's going to get continuously better and better. He's just like, he's looking for it where he felt like at one point he was very handsome. He was looking very, very good up until the point that he started having a lot of acne. And then, of course, the scars too. So it made it really difficult, really, really tough for him. And I was hearing those kind of stories over and over. One of my other patients, she was talking about how she had severe acne really when the time she was 11 years old for her. And it was just the amount of suffering she had to have, the amount of loneliness and isolation that occurred with it. So it's a story over and over, this patient also. And they just feel like they're looking at themselves. It just doesn't look like themselves. It doesn't look like what they should have been. And it's really nice to be able to get to this point where we can look at things and say, this is, progress. We're getting there. There's a light at the end of this. Even though she was turned down so many times, she was also pushed treatment packages that weren't going to be effective. We ended up getting something really amazing for her. We ended up getting to a point where she could feel really comfortable with her skin. James, how's it going, James? James is asking, for the Juvalook case, was there really such a thing as a golden window to reverse it, considering hyaluronidase is only for HA? So what James is referring to, and sorry, I saw your question yesterday at the very end there, but it's a good thing you came on again to ask that again. But the Juvalook case, for those who don't know, there was a situation, it went viral on TikTok, where somebody had done Juvalook, which is a filler that they have available over in Korea, and it actually caused blindness for her. Really, really terrible situation, actually. The filler actually went into a blood vessel, likely I suspect, essentially, and that ended up leading to blindness. And what James is asking is that was there a golden window really to reverse it? Since Juvalook is not just really it's not an HA product by itself. It's also with PDLLA, so it's sort of a derivative of lactic acid. And so it doesn't really make sense that you would use hyaluronidase to dissolve it. but it is actually combined with a little bit of hyaluronic acid. So it's sort of actually, interestingly enough, Radiesse also has that, where it's a bit combined with a little bit of hyaluronic acid there, like a tiny little bit of that, just as like this molecule that's part of it. And so yes, if there is an occlusion, you do want to do hyaluronidase to actually break down some of the hyaluronic acid there. In fact, actually, sometimes you could actually, if there's really true compression and you're doing a procedure on somebody and it's something that's not supposed to be easily dissolved with that kind of product, but you could actually do a little bit of hyaluronidase even still, because maybe actually that would actually relieve some of the pressure that sometimes could occur with occlusion. It's kind of, off-label, not exactly what we would recommend normally, but that's a possibility. The other thing, interestingly enough, sometimes that works is actually steroids. Steroids actually reduce that inflammation too. That could actually help as well. Heat is another thing that could end up working out really nicely. If there's a small little occlusion, sometimes you put some heat on there, and that could actually help as well. So, there's a few other options potentially, but I didn't follow the whole story. I just saw really briefly what she was referring to, which was that she had gotten blindness due to filler, and a really terrible situation, of course, a young person that got that. Which is like the biggest nightmare that we all have, and there is a time period when you really do want to make sure that you could dissolve it and do that urgently. You keep on working at it. Sometimes you don't have to do it though. You could do like steroids, you could do massaging, you could do heat. It just depends on like, it's a small little vessel, a big vessel, and what's happening with that. And ultrasound really helps. Actually, I could take a look with the ultrasound. Actually, when in doubt, I could take a look at the ultrasound to go to look directly at the vessels, look directly at the blood flow, and really get a really good idea there. Hold is saying, in the absence of a doctor who can perform liberator subcision, what is the best way to release deep tethered rolling scars? It's a good question. I mean, it's possible that it's not going to be released completely, but you could still do that with blunt cannula subcision. The problem is that so many people aren't good at blunt cannula subcision. So I mean, find for someone who's good at blunt cannula subcision first, which is very, very difficult anyways. My patient earlier today, he came from Chicago, and he said that he did, I think, 7 rounds of lasers, also with radiofrequency microneedling. And the dermatologist that he went to in Chicago, he went to 2 different ones, and they were saying he doesn't need subcision. Well, they don't really do subcision. I knew the dermatologists, actually, they don't really do subcision. And it was not true that he didn't need subcision. When I worked at him today, there was so much scar tissue. He was shocked. He was shocked at how much scar tissue there was there. And it was so stuck. We ended up doing Taylor Liberator for him, and we released it completely. So it's unfortunate. Someone sold him 7 lasers, and also like radiofrequency microneedling. And a lot of people would promise that that's going to actually solve your tethered bonds. They will actually sit there at a podium. Actually, I was sitting there, about 10 years ago or so, I was sitting there listening to these lectures, and these guys were insisting, this was on radiofrequency microneedling, was really, really being pushed by a lot of people. And, these key opinion leaders who are bought by these companies, by these laser device, energy device companies, and they don't really reveal it a lot of times. They're bought by them, and they're pushing that radiofrequency microneedling could actually get rid of these tethered bonds. And over and over and over again, we see the case that it's not getting rid of it. So, it's like a lot of people will just claim that they don't, someone doesn't need subcision when they clearly do. It's because they can't do it. They're incapable of doing it. They don't have the skill set to do it. And that's one of the things that's why I also, I partner with my plastic surgeon too, because I want that the full gamut. Really, there's nothing that we can't do for these things. If they're really, if we do run into a case that we can't, we'll just say that maybe there's some expert out there that can do this particular kind of scar. But it's like, we want to be able to solve everything completely. So, there's a lot of people that just can't do it. And there's a lot of people who say that they could do blunt cannula subcision, and I see their work over and over and over again. And there's so much scar tissue still afterwards. And, there's these claims that they'll say that, oh, well, it retethered, or it's like did this and that. And then it's like, why is it that it's retethering with your particular patients, but it doesn't retether when there's somebody who's really good at subcision, and I have to do subcision for like a small little spot. Everything else is clear. But the other ones, everything is still fully stuck and fully tethered there. Clearly, there's a huge gap in skill. Clearly. And, part of it's just people didn't learn how to use their hands. People didn't learn how to feel with their hands. And they're incapable of doing it because they just didn't get that skill set for so long. They didn't get that skill set. So it's tough to find that. It's tough to find people that could do subcision very, very well. And it's so important for rolling scars that are deep like that. Really important there. Keep It Zen is saying, can scar tissue grow back and start pulling the scar down again? Is subcision something people need maintenance on? So that's a good question. That's exactly what I was referring to earlier. I really don't see like this proof of that, really. I do think that there's times when if you get new acne could form, of course, new scars, and that could end up causing scar tissue. Volume loss, though, is really something that lags. We have to catch up on that volume replacement. And a lot of times that's something that we have to do under a few sessions, especially in areas around the mouth. You can't just like shove a bunch of volume in there. You have to go slow with that. So we want to make sure it looks natural as people are smiling and talking, things like that. So we're going to do that very, very slowly. And it's going to be a process to do it. It's going to be a slow process to get that volume. And that may be what you actually need. If it needs a true subcision, sure. But I'm really hesitant to say that's due to just the fact that it retethered or just some concept that it retethered. I really think that the people who say it retethered really need to prove that it retethers. I really do think that it's on them to prove with actual evidence. They could show, ultrasound, they could do high resolution ultrasound, show actually really clearly that the tethers were there. They cut the tethers with the subcision. And then, they followed up with a patient. It was cut. Now, 6 months later or so, there's retethering or something. That's on them because I don't make that claim. I think it's an extraordinary claim. I think it's a very difficult claim to really say. I do think it's a more technique issue. I think it's a skill set issue. And that goes even for like everybody. Everybody has things where you just couldn't do a complete. Like, for example, in parts of the lower face, I may not be able to get to every single part of that tether bond because it's just maybe unsafe for patients. And maybe that's what's holding back. But there's areas of the face where it really should have been done. Like, it really should have been done properly. It just wasn't done because of laziness a lot of times, really laziness. And it's like, I can ever have anybody say that I'm lazy, ever. It's like just the biggest thing in my life. Mama Qazi, like, she told me, like, never ever be lazy. It's just like the biggest thing in my life that I'm never gonna be lazy. So it's like I can look people always and like whatever happens, we're never gonna be able to say that this was just a lazy job that someone did, that I did. And it's like, so I have that kind of thing. Like, that's on me always, that I'm never going to let something, come down to the fact that I just didn't have the willpower and didn't have the energy to do something. That's just terrible. So like, that's just a terrible, terrible thing to do. But I hear over and over and over from patients who say that, we tried to do subcision or something like that, and the person did it in a way that was just like a one spot there. And you look at it, there's so much scar tissue. And even in that one spot that they supposedly worked on, there was so much scar tissue right there. There's so much scar tissue. So clearly it's like what they were doing wasn't working. And, they sell them on 4 or 6 package type of stuff for subcision stuff, and an invasive procedure that you're going underneath there. You're selling these people these packages because you're incompetent, and it's like, I think a lot of things have to just kind of shift from that, like where you have to just look at this and think of that is really more of a competence and skill set issue. It's not an issue like people said. And the truth is that it totally destroys a lot of what people's whole business model was, to do this package stuff, to do this thing where you have to keep on having people come back and forth for something. And imagine forcing someone to come back and subjecting someone to subcision. I did subcision. Actually, ask those physicians if they ever had gotten subcision done on their face. I've gotten subcision on my face, and it wasn't something I want to go experience again over and over again. I just want it to be done properly, and it's like I got it done properly. It's like I wouldn't want somebody to go subject that over and over again. It's terrible. It's a terrible thing to do. It's like every single thing you're doing on someone, it's invasive procedures. These are procedures that have risk. My other patient today, he was talking about how he has such severe scars. We're going to do a phenol peel on him, actually. Such severe scars. I was doing subcision right now, and he was sold this microneedling package, and it was such a sad story. It was such a sad story that he has scars at a young age, who tried to go to a dermatologist, and they just basically said he's going to grow out of it, and just gave him a little bit of topical antibiotics. He got some acne scars from that, and then again he got cleared up, and then in his 20s he got more severe scarring, and then he went to his dermatologist, and they still did the same thing. This time though, he was prepared. He looked up, did some research, saw that there was some things like isotretinoin or Accutane, talked to his dermatologist about it. They ultimately put him on it, and it cleared his acne, but now he was left with severe scars. And guess what happened now? As his scars got cleared, and he has severe deep scars. His acne got cleared. He's got severe deep scars. They sold him on a package of microneedling now on top of it. And it's really upsetting now, right? Like that's just like upsetting. And it's like, there's a lot of people then end up feeling like they could have anger towards us. They could feel like they're just, they feel like there's a system that they just can't control, and it's out of their hands. It's really upsetting. So that's like a part of what I want to do is I want to solve a lot of anger. I think that we have a lot of anger in this world, and I want to solve that. I want to make it so that we no longer have that kind of anger, especially due to scars. I want people to feel really, really good and look at this like this experience that makes them feel just better as they look at themselves. And that trauma of being bullied and all those type of things that occurred, really it's going to be this cathartic release as we do this. And this time for today was actually a very interesting situation. I think a lot of people are very stressed out and things like that, but at least in the moment that we're doing these things now, it's like you could just feel this release with the patient too. You could feel it. And they even told me that. And Stanley, I'll get to that question in just a moment there, but yeah, it's interesting actually. It's a very interesting, feeling really. I never really was somebody that was involved in in psych and things like that. I just felt like I understood psychiatry a lot, psychology a lot, because of just like everything I grew up with and saw. I was never formally trained separately in it. But, of course, like medicine, we do rounds and things like that with it. But it was just something interesting to me because you don't really talk enough about, or people don't really necessarily talk enough about just what they go through, not just as they had acne, not just what they have scars, but also with the physicians that they're interacting with, who then are telling them that their acne is going to clear up on its own over the course of a few years, or tell them that, as the acne is clearing up because of I should try to know that they put themselves on or so, that now I should do microneedling for these deep scars. It's a frustrating experience. It's a very frustrating thing. It's something that does get people angry then. And it's I really want them to I want this world to be less angry, really. I think there's a lot of anger, and it'll be really nice. I found myself, honestly, one of the biggest things that helped me be successful is to just allow myself not to be, really work on making sure that I'm not angry with things. And it's so amazing actually that way. I just don't get angry like that. I just it's really nice. I just try to find solutions for things. And it's just let's find a solution here. Instead of letting yourself get angry. And so that in this world and this type of thing, I could find that solution. And it's actually cathartic for people. Stanley, what was the question there? He said, what do you recommend for Icepick scars on the nose? On the nose, what we would usually do is actually just TCA Cross, and we just continuously place a little bit of TCA there. That's usually what we do, just low levels of TCA, just constantly putting a little bit on there, because you don't want to go too much because it could get wide kind of fast. You can't use too much heat, too much energy for that area too. So Icepick scars especially, just do just constant TCA. If it's eventually as it starts getting more superficial, you could then do a laser. Or if it's thicker around the edges, you could just jump at the laser right then that first session and do some TCA with it. And the other thing that sometimes helps, depending on how much fat loss there is, things like that, you could do a little bit of collagen, like Bellafill, for example, there. It just depends. If it's a true Icepick scar, you may just do TCA Cross though. Thermage versus Ultherapy. When do I get one over the other? Late 20s. I don't love either, honestly. I don't like heat and energy devices that could potentially destroy fat, and especially in a young patient. There's a lot of better options out there. Just lasers by themselves, really, you could do that are just going to help your texture. That's going to make it so it looks a lot better. So that's typically what I end up doing. More things like erbium laser, for example, just do low heat, low energy forms of that. It works incredibly well. How's it going, Dr. Dunraj? Good seeing you on too, by the way. Valley Brad is saying, I'm on my second round of Accutane, such bad scarring, and I don't know what to do. Are you saying that you're on it and you're still getting a lot of acne right now, or is it just that you're seeing really the scarring? Because if you're on Accutane, I can still treat you for your scars while on Accutane. We just take a look and see what's happening there. I appreciate you, Dr. Dunraj. Thank you. Whedon Pooches is saying, is 70 too old to have my scars attended to? I've done everything. No, I actually have treated patients in their 80s, actually. It's actually really rewarding. There's no time limit. Really, at any point in your life, if you feel like this is a time really where you want to start improving, why not? Why is there a limit for it, You look at yourself that you just were robbed of something for your entire life, and there weren't many great options. Really, for a long, long time, there weren't many really great options. I hope Dr. Dunraj is still on here, but it's actually interesting because he's somebody who also has done a lot with realizing that we need volume replacement. And it's something that just wasn't really dealt with a lot for a long, long time. A lot of people just didn't really understand that you have to do the subcision portion, these manual things, and then do a lot more with volume replacement. And instead, they were just telling people just do lasers over and over again. And even if I laser this particular patient 20, 30, 40 times, it still would never get to that kind of improvement. Never would do that. And what Dunraj is saying is nice to see realistic, unedited results. I want to show that. I want to showcase to people what is something that you really could achieve. Now, this was something under about 2-3 sessions, I believe, for most of this patient. When the sessions were different, though, we did subcision, we did laser, we did TCA Cross about 3 times or so. We also did some radius for her. So, it looked like over the course of about, 9 months there. So 9 months later, you can see significant improvement, and we will continue to get better improvement. A lot of people tell me, though, it's just, the thing is that they're happy with it at that point, or just, cost prohibitive to do more. It's not really worth it for that point. If they are ready, they feel financially ready to do it, I'm here. I'll be able to help them. I never want people to feel like this is a stressful thing that they have to break the bank for or things like that. If they should be in a spot where it actually makes sense for them. And we could get there, we could get there over and over and over again. It's just about being really patient with doing this. And you notice in this particular case, for example, I broke up that scar tissue. I didn't then put that volume that same day. I did it later because in this lower part of the face, we got to be really careful. We don't want to put excess amount of volume there. It could end up with gravity. It could end up looking like it's actually sagging then. It could look like it's more swollen over there. It really could cause jowling, things like that. So it's stages. And this particular patient, she totally understood it. She understood that this journey, she just suffered from scars for so long. She just wanted something to just make her confidence better. And we got that. We got what she wanted to get there. And she's very, very happy. Extremely. She's a very, very good person. Weeding Pooches is saying, I'll be in touch. You've given me hope. Good. I'm really, really glad, actually. And you could do, actually, just directly on my page, just go at drqazi.com and you could set up a consultation that way. What do you feel about CureJet from Korea? Actually, Dr. Dunraj, I don't know if there's a way to invite you on here. I think you've used that, right, Doctor? Have you used CureJet at all? You're on right now as well, so I'm not sure if you play around with it. I haven't played around with it myself. I know some people have been asking about that, but there's a lot of people who say that just it doesn't work really that well. I'm not sure if you found that it was something that was helpful for you, because I haven't really seen you use too much of it or anything like that. But I tried something similar to it. I didn't really feel like it was too helpful for it. I thought really ineffective for what it was doing. But I haven't played around. So you're saying that you've seen the device, seems interesting. So I'll let you play with it. I'm not usually the person that jump at the device initially, but if you some other people kind of look at it unbiased and say, hey, this is something that's cool, we could take a look and see, I'll be open to it. It's it's tough because some of these guys, they make so many claims, and then a lot of these other ones have this concern that really the results aren't real, because it's 1 week later or something like that, there's some micro swelling. So it's tough to say. So it has an attachment which can be integrated with the Fotana YAG, which is awesome. Okay, that's pretty cool. So it can be attached to the Erbium YAG with that CureJet. So I'll take a look and see. Thanks for letting me know about that. I'll take a look and see if it's something I should take a look at. But I'll let Dr. Dunraj play around with it too, and other people that maybe come on there. Is there no risk of VO with injector when doing skin booster? No, there is actually. There's still a risk of vascular occlusion with any filler, anything. It's just how you're doing it, how much pressure you're placing in there, where you're placing in the face, how careful people are, things like that. There's a lot of stuff that that's involved with this, and there's a reason why these price points are a certain way. Really, there's a lot of work that's involved. There's a lot of work. It's not necessarily the amount of time we spend per se, but it's the amount of concentration, amount of focus we do to make sure we could do it really safely. So we could do it really well. Frank is, how's it going, Frank? Frank is saying, hey, Dr. Qazi, I'm glad I caught you on here. I have a cure tomorrow, and your office only sent me the form today. I just finished work and logged in to sign it. It says nicotine is a risk. I wish I knew, and I don't have to stop taking it weeks ago to prep. I don't smoke, but I do chew nicotine gum about once or twice a day. And sorry, the question is, I should still hold off a week or two. I did Okay. So yeah, basically stop it now. The thing with nicotine, thing with these products is they essentially could cause more oil production. We want you to stop that. So going forward, from this day forward, you're going to do the cure tomorrow. Just from now on, you're going to not be using nicotine products. And if you need to, it actually place you on something to help you with your nicotine habit. Honestly, one of my other goals in life is to actually get people to stop smoking, get people to stop drinking. Honestly, it'll be really, really great. You see it over and over and over again, the consequences of smoking and drinking. and then I'll get into more like fatty food and like saturated fat, like highly saturated fat, all that stuff. Like I'll get into all that stuff. I'll get into like the stuff like I don't believe in like eating carbs after 5 p.m. and do all that. But like I'll start where I want to start is actually really simple. I want to get people to stop smoking, at least for your skin. It really does increase your oil production. And I want habits that people actually also stop drinking. So if you're using it right now, like we could try to work on something to help you get off of tobacco or nicotine products. There's a lot of different options actually. But something really important actually, really, because it's like obviously for your lungs, but what people care about, they see all the time is their phase 2, and that oil production can get excessive. So it's not that you necessarily, for scar purposes, I definitely need you off of it. For the Accure purposes, it's more for that oil production issue. So stop it now, then we could, just continuously stay off of it there. And if you need help with it, we could help you with it too, Frank. So let me know. Evan saying left with a rolling and Icepick scars after Accutane, microneedling is not working at all. Well, those would not help with that at all. So I would absolutely try to work more with Subcision. We will work with things more potential, which is like volume replacement. That's like first line really. If there's thicker edges of the scars, then I use more like ablative CO2 laser, things like that. Those are things I would usually use. So that's typically what I end up doing. For the Accure laser, do you use topical numbing or the needle? Usually I do both, actually. I just want people to feel really comfortable. Actually, at this point, people are comfortable with it. I ask people as they finish things like that, and it's like I hear it all over and over again. It was fine. Everyone says it's fine now. So it's like, 45 minutes, we're done. And the numbing is perfect now. So it's like we got the numbing cream, and then we do the nerve blocks that just make it so it's just completely out, which is perfect there. What do you think about Fraxel Dual 2 sessions for acne scars on the face? I mean, it has to be really mild, superficial scarring, really, for it to be beneficial. I wouldn't really recommend it, to be honest with you, for the vast majority of scars. Look forward to seeing you, Frank. I'll see you tomorrow then. Shamans is saying, have you encountered patients with strong histamine reactions or hives from CO2? Really, but yes, you could get that. And you actually may need to be on Claritin or Benadryl at nighttime. Yes, you may actually need to be on that. That's actually a really good question that you asked that. So for those who don't know, sometimes actually what people think are allergic reactions sometimes are more like just like a localized histamine reaction that could occur. Or I could just say that sometimes they even think it's a burn and it's actually just more like a histamine reaction. And you can control that better with antihistamines like Claritin, for example. And that's actually a lot of times actually would be really, really useful for people that they do feel like there's a little bit more reaction. Sometimes though, what ends up turning out though for people is that you hear stories, I went to get a laser somewhere, I did something else somewhere, and I got this reaction. And you wonder, was it completely clean with the numbing cream? I actually don't use numbing cream for my patients. I do it actually with nerve blocks when we do scars, because the numbing cream has a little bit of micro swelling. And that micro swelling could actually mask the scar tissue. So I actually like it exactly the way it's supposed to be. I don't do topical numbing. My patients don't feel pain because we do nerve blocks. And we do the nerve blocks and they don't feel any pain there. So, less likely to have that problem. But that's really a possibility that a lot of times what ends up being is that they had numbing cream on there and the numbing cream wasn't completely clean, especially really with things like radiofrequency microneedling or regular microneedling. You'll see sometimes this bad reaction afterwards and people will say, well, something allergic, blah, blah, blah. But actually maybe the numbing cream that they kind of microneedled it into the skin. And that's not good, of course. Do you ever use HA filler for scars? If people want that, I could do it. Of course, it's super easy. Honestly, I could like all day long, I could get like amazing results. Actually, honestly, if I just did HA filler, like it's super fast. And I see people always like 1 month out anyways. And I could always just like get that 1 month result if I just did it that way because it's super fast. Everything I do is actually sort of the opposite. It doesn't look the greatest at like the first like 3 months. It looks really good like 6 months, a year and a half later. But like if I just did like a bunch of HA filler on everybody, I would just be like nonstop, just like that's like it. But the thing is that I don't believe in it. So why would I do it? It's like I don't believe in it because it's just temporary. It's not a thing that's going to last long for people. It's not improving the scars not well enough. I don't like that it draws in water. So there's so many things I just don't love about it. Like I do it for like a quick fix for some people. Let's say they have like a wedding coming up, something like that. Sure, cool, I'll do it for you. But just knowing it's not going to last, it's like, I'm not really too excited about doing it though, to be honest with you. It's like, I could get a great result. It's just like, okay, something that's not going to last that much. I'm not sure why I would do it. I like things that last a long time. That's the way I am. Like I'm the way, like I just want things like that are going to be there. And I want that like where over and over my, like the years, my skin looks better. My face looks better. That's like amazing to me. You know, one of my patients, it made my day actually. He was like, you know, I saw you like a year ago, see you now, and it's like you look better now than you did a year ago. That's a pretty nice compliment when you actually think about it. That's a really nice compliment then. And it's like, you know, that's the stuff clearly works then, right? Like it's like clearly the things that we're doing are improving things over time. That's the whole purpose of it. But if you look at a lot of other people, a lot of the people that do like HA filler, things like that, over time it looks like it's just like a little bit abnormal as their skin is aging. It just doesn't look good under the skin now. It looks like it's just not as great. And it's like, that's why I don't love it, you know, especially in like the mid cheek. I don't love it there at all. Like small little spots here and there, that's okay. But the way people are doing it, which is really unfortunate, really terrible. And, you know, it draws in too much water. So I don't love that either. Rashna is saying, do you recommend phenol peels for brown skin? Really rarely. I doubt it. I really doubt it. Especially Fitzpatrick 5 and 6 would be very, very unlikely. Fitzpatrick, 1 through 4 potentially. So it depends on where you are, and we could go through that to see if you're the right candidate for that. What's your opinion on Sculptra? I love Sculptra. It's a really, really great product because it can stimulate some collagen, also gives a little bit of volume. So scars look better. It looks a little bit more lifted too. So it works really well for a lot of things. I appreciate you. Thank you so much, Mrs. Jones, saying this is a great result. I appreciate everybody who said really nice things too. I like showcasing like that journey, the realistic type of process here. And so everybody really understands. And this is, this is something that people feel like there's no hope for. And here we have, if this is like where you look at it and you say, this makes sense, awesome, let's do it. And that's what we could do. You know, we could do this. This is a very achievable result. This is a very, very achievable result right here, just so you know. Like this is like very common. We could get this kind of result. So it's like doable. Let's do it. You know, and it's like, I want people to understand that this is a very achievable result. And of course we could get better. Of course we could do things. It's going to cost more. We could do that. But I want people to understand what that is, what that means, that this, at this point, this is achievable. And we could continue, depending on your genes, depending on everything else, we could continue to get better and better results, and depending on your budget. That's a factor there. If you don't like needles, are you able to get the topical cream only for your acne laser? Yeah, yes, you could, of course. Yeah, there's some people that just do topical cream. I just tell people just to do it with the nerve blocks because you're just going to not feel anything then. But yeah, of course, if you don't like needles, good thing, it's going to keep you away from IV drug abuse. That's good. The fact that you don't like that, that's good. Ink Wonder is saying 2 subcisions, 5 CO2, 2 TCA Cross, and 2 chemical peels will give good results. It's possible, yeah, depending on who does it. Depending on who you're going to, it's possible that that's a good combination of things that will help you with that. All right, guys, thank you so much.